Hello everyone, welcome back to our channel. Today we're diving into the last part of our series on cardiomyopathy, focusing on complications of VADs and TAHs and more importantly, nursing management. So don't forget to like, share and subscribe to our channel and let's get started. Complications of VADs and TAHs include bleeding disorders, hemorrhage, thromboembolism, hemolysis, infection, kidney injury, right-sided heart failure, multi-system failure, and mechanical failure. Nursing care of patients with these mechanical assist devices focuses on assessment and minimization of these complications, as well as providing emotional support and education about the device and the underlying cardiac disease. Promoting home care and community self-care education to patients is a key part. The nursing care program includes educating patients about medication regimens, tracking symptoms, and controlling disease symptoms. The nurse plays an important role in helping the patient balance lifestyle and activities while performing therapeutic activities. Helping patients adapt to their medical conditions helps them adjust their lifestyle and implement their home care plans, and achieving this goal makes the patient feel good. The nurse's ongoing care reinforces previous learnings and continuously checks the patient's signs and progresses. The nurse also helps the patient and the family adapt to lifestyle changes, and educating patients on reading food labels, regularly recording daily weight and indications, and adjusting daily activities to increase activity tolerance is also provided. In addition, the nurse will check the patient's response to recommendations on diet and fluid intake and medication regimen, and stresses and signs that should inform the doctor. Because of the risk of dysrhythmias, cardiomyopathy resuscitation and the use of an automated defibrillator may be required. Women are often advised to avoid pregnancy, but each case is checked specifically. The nurse examines the psychosocial needs of the patient and the family according to current principles. They may be fearful about the prognosis of the disease, changes in lifestyle, the effects of medications, and the likelihood that other people in the family will have it. These concerns often increase the patient's anxiety and interfere with effective adoption strategies. Establishing trust to communicate with these chronic patients and their families is vital for nurses, and this is especially important when the patient or family caregiver is facing discussion about end-of-life decisions. In patients who have significant signs of heart failure or other complications of cardiomyopathy, it may be helpful to offer appropriate home care. Evaluation of expected patient outcomes may include 1. Cardiac function is maintained or improved. 2. The patient's number of breath and heart rate are within the normal range. 3. The patient reports a decrease in shortness of breath and an increase in comfort. Gas exchange is maintained or improved. 4. The patient does not report any weight gain because weight is proportional to height. 5. Patient's peripheral blood flow is maintained or improved. 6. Activity tolerance is maintained or improved. 7. The patient performs activities of daily living like brushing teeth, eating, and reports increased tolerance of activity. 8. There is less anxiety in the patient. It's easy to talk about prognosis. 9. The patient expresses fears and concerns and participates in support groups if necessary. 10. The feeling of incapacity in the patient is reduced. The patient makes emotional responses towards the diagnosis and talks about the control they have over their life. 11. The patient follows a self-care plan, takes medications according to the prescribed schedule, adjusts their diet to comply with recommendations regarding sodium and liquids, moderates their lifestyle to adapt to recommended behaviors of activity and rest, and recognizes the signs and symptoms that should be reported to the healthcare provider. That's it for the last part of cardiomyopathy, including complications of VADs and TAHs and nursing management. If you found this information helpful, don't forget to like, share, and subscribe to our channel, and stay healthy, stay informed.